as I stated before, by creating these massive impulses, and I demonstrated before everyone, I awaking reflexes. And now look, 1, 2, 3, and previously I did, you remember briefly, I will repeat what I did, like this, hands after hand, all these wonderful techniques, and already we start stimulating central nervous system, upper and in level motor centers, in the lower level motor centers, and little by little, when come to the petrissage, it is already, and you see 1, 2, 3, 4, and when I will repeatedly, in this kind of taking time, already when it come to petrissage number 1 and 2, I deeply and deeply moving, and actually peristeum, deeper cannot be. I perform a very deep tissue massage by awakening reflexes, by understanding, gradually increasing pressure, digging in, digging in, digging in, digging in, digging in. This is the one of most important techniques. Now, if your client's bigger in size than you, yeah, you can utilize in the kind of petrissage number 5 with elbow mobilization. Number 6, fist. I will demonstrate all these techniques in cases if somebody would love to feel stronger. With no trauma, we can actually compromise with them to perform and to provide them with stronger feelings, and not to traumatize. In our case, we should not traumatize. First strategy is to awake these reflexes that allowed muscles layer by layer will relax and will allow tension in fascia will be reduced with every hour movement of mobilization, and will allow us to go deeper and deeper and deeper. This is kind of one strategy. The second strategy is to shift tissue. An example right now I will demonstrate in cases of piriformis muscles syndrome, that in most cases awakening sciatica nerve neuralgia, I will right now will little bit briefly will come to this point, that I will show you sometimes it's just necessary to use this strategy to shift the tissue, the superficial layers, in order to be able to mobilize deep tissue. In cases of sciatica nerve neuralgia due to piriformis muscle syndrome, when come to mobilization of piriformis, and piriformis originate from anterior part of sacrum and insert into greater trochanter area, and covered actually by glutes. Here, in order to perform deep tissue massage, we have to shift. You see what I'm doing? I'm shifting, and right now here we're utilizing, because of bigger mass here. But first of all, you see, if I will compress, I will transmit some pressure to the piriformis muscles. Very little mobilization will be, but the other strategy is to shift the tissue upwards, and here you can see I will put even elbow, and I do recommend to utilize elbow for stimulation. We know the topographically how this piriformis located, and little by little we will do with elbow mobilization and compression even from this, but this will be due to our capability to shift the superficial to go. This is the other strategy for deep tissue massage. And when we're treating thoracic outlet syndrome, and the main cause of all this neurological picture and all this edemas and the change of colors is overtense anterior scalene muscles. Now, anterior scalene muscles is considered to be deep muscles and covered by sternocleidomastoid muscles, and in such a case we just have to shift. We have to shift sternocleidomastoid. I usually do this with thumb, but for camera and better vision, you can do with fingers also. You kind shifting, you see, and here you come to the deeper tissue, which is anterior scalene. Yes, you have to shift and, of course, stimulate, shift and stimulate. By the way, as you know, sciatic and nerve neuralgia, thoracic outlet syndrome, anterior scalene muscle syndrome, thoracic outlet syndrome is the most difficult pathology to treat. And in most cases, doctor performing surgeries. From my experience, I know if we will do the right protocol, if we will do and we will follow the protocol, we can reach results in very fast. The other strategies that we using for deep tissue mobilization is a transmission. How much we will mobilize will shift. Not always we can reach the deeper layers that have to be stimulated, and therefore we use techniques of transmission, compression. Actually, from perspective of physiological effect, this is kind of double benefits, and one of the techniques what we utilizing to break down scar tissue, all this, you see, if they're chronic long-time tension in fascia will be, it's an adhesive phenomenon. To break down all this stuff, we're utilizing like stretch first of all, you go with Nagel's, and again, in post-event sport massage, it's massage. This is the most deep tissue techniques that could be, and you stay like gradually increasing pressure, 10-15 seconds, and again, and this is called transmission of pressure. Now, all organic and inorganic material carry piezoelectrical potential, and when we providing this compression, we also making stream potential, stream of piezoelectricity that also stimulating inner organs, and of course inner organs reporting this generation of this afferent impulse will reach centers, and this is kind of additional accord of stimulation, massive stimulation, flow to move the chi, flow.